everybody, and welcome to tonight's live. I am apologising firstly, and I should have put something in stories, that we are starting a little later because we forgot that the wonderful Kimberly from Oasis Chiropractor or Pregnancy Chiropractor is in Perth, and she has a little one. So it was hello. So it took... She had to wait until hubby got home from work to be able to look after her toddler. So she is going to be, I can see, hello Pregnancy Chiro. So Kimberly will just request to join shortly. There we go, superstar. And I'll, so we had to delay it for half an hour because we forgot about the WA time difference. So Kimberly will be coming in shortly. Hello, there we go.
Hello, can you hear me okay?
Beautifully, thank you. And I was just explaining why we were a little bit late, not factoring in the WA time difference.
Yeah, sorry, I have bed hair because I just woke up from a nap. Pregnancy problems or privileges.
That is like life goals.
Yeah. Milking it
Thank
life.
you so much for joining us and Breastfeeding here tonight. Kimberly and I just had a little quick chat on the phone, and really the joy of tonight is they don't have to listen to me bang on all night. It's more about you sharing a bit about what you do, what you offer to pregnant women, and I guess just the importance and, I don't know, giving you top tips of what pregnant women need to know about the importance of positioning during their pregnancy and how that can impact their labour and birth. So I really am just going to hand over to you to introduce yourself and say hello to everyone.
Well, thanks so much for having me. I just wanted to start by saying I've started watching your program. I think it's amazing what you're doing, especially in our current climate. It's so good that women have that resource there, because knowledge is power, and when you're pregnant, you definitely want to be in a position of power and not a victim of not knowing and having decisions made for you. Yeah, so I'm a pregnancy chiropractor. First of all, chiropractors have a minimum of 5 years of university training, which a lot of people don't realise that to begin with. I myself have done a Masters of Chiropractic at Macquarie University, and I've also done postgraduate training in paediatrics as well. So it's a 2-year program on top of that. And I've also done my my practitioner aware training in optimal maternal positioning and spinning babies. So see lots of mums, lots of bumps and babies and children and families, and educating women is something I'm very passionate about.
Yeah, amazing. And I think, like what you just said, a lot of people probably underestimate maybe like the training and the knowledge that goes behind becoming a chiropractor. And I think, and I'm projecting here a little bit, but a lot of my women might be a little bit hesitant about going to a chiropractor when they're pregnant. If you're happy to share, are you happy to share with us about the difference in how you would treat someone who is pregnant or someone who's not pregnant? I know that I saw a chiropractor as a teenager. I had glandular fever and thankfully had very open-minded parents who embraced a lot of treatments for me. And I remember my chiropractor and really pretty intense manipulation. Again, that might have been to do with the fact that it was a long time ago. And then when I was pregnant and planning to go to the chiropractor, I felt a little bit anxious about that because I went at 35 weeks. I had my first baby with breech. Are you able just to explain to some of the women what going to a chiropractor when you're pregnant would look sort of and feel like, really?
Sure. So when a woman comes into our office, and every chiropractic office, you will have a full chiropractic, orthopedic and neurological assessment. So we always assess the body as a whole. Now, women in pregnancy, they always have it's a constantly changing landscape. So a woman's body at the start of pregnancy is not going to be the same at 6 months or 9 months of pregnancy. So you need to adapt the treatment and your way of analysing the body accordingly. As you progress through labour, you have a lot of relaxant floating around, so you need to be mindful of that as well. So the adjustments that you would experience in late stages of pregnancy would tend to be a lot lighter than in a non-pregnant person as well. We would assess the pelvis. So the pelvis is a huge focus in pregnancy, obviously with the baby being needing to sit within that space. So we really work on making sure that that's symmetrical and all the surrounding musculature is not under any undue stress. But we look at the whole spine as well, because it's about optimizing nervous system function, and that's brain-body connection. And if there's any interference with the way that the brain and the body can communicate, that's going to affect the body's way to self-heal, self-regulate, adapt to stress, and ultimately perform in labour and in the rest of pregnancy as well.
That's it. And we ask a lot of that pelvis in pregnancy, labour and birth, don't we?
Yeah, definitely. So what I want to stress, though, to women is that pain in pregnancy is not normal. So pregnancy was not designed to be painful, and Mother Nature did not create us to be in pain during pregnancy, because that just wouldn't bode well for the existence of our species, would it? Like if people knew how horrible, if it was awful, they're going to be in intense pain during pregnancy, would it really be appealing? Not really. So that's just something I want to stress straight up. And that can be a big eye-opener for a lot of women, that, oh, I don't actually have to be in pain just because I'm pregnant. And, you know, we support women all throughout pregnancy and help them to have pain-free pregnancies. And that's how it should be.
Yeah, and I think that's a really nice way of putting it, because often when we're doing our Q&As, someone will say, oh, I have this intense pain here, or I have this dull throb, you know, for 8 hours. And I was like, and I'm constantly kind of saying, I really think you need to see someone that's not the norm. Or, but I feel like it's almost becoming the norm.
Definitely. And it really gets my goat when women are told by their care providers, oh, that's just pregnancy. Oh, that's normal. Oh, that's just to be expected, and you'll just have to put up with it. I think there's a load of BS, and it's really not enough for a woman to be told that. They should always be told that there are options and there's a better way, and that healthy is always normal. Pain-free is normal.
And maybe to get another opinion on that as well is a really good idea. I know as well with feeding your baby, and women are told, you know, oh, it'll just hurt for the first few weeks. And I was like, no, or like it hurt for the first few weeks. I was like, no, it's not, that doesn't have to be like that. So that's great for you to be able to share. I will say what I would love you to share with the women, because I'm often being asked, what are the top things that I can do day to day to be getting, because I'm a huge fan of optimal birth positioning and getting baby into the optimal birth position. Personally, for me, Polly was breech until she was 36 and a half weeks. And I still remember being in the car behind the steering wheel, and I was quite like, I had a big belly for my first pregnancy, and I could feel her turning after about my first car, and I felt like I was about to vomit. It was a really intense feeling. And she'd turned, and it was just before I was booked in for my ECV, so I was 36 and a half weeks, and she'd been frank breech the whole time. I was a breech baby, and I had the hips and everything related, and she's the first girl, so everything was loaded for her to be breech. But then she turned again. I would love to hear just your opinion on probably some tips on what women who are pregnant now could be doing just in their day-to-day life to be improving that. And then when to go to a chiropractor. And this is in pregnancy. We'll talk about with newborns in a minute. Yeah,
sure. So there's never a time that's too early or too late to go during pregnancy. I've had women, you know, being induced the next day, coming in at the last minute to see me. And the earlier in your pregnancy you do see a chiropractor, the best outcomes you're going to get, because you can achieve so much more. Obviously, if the later gestation you are, the baby's already nestled in that position, it's less likely that you're going to be able to create that space. So 36 weeks for you is probably the sweet point. It is a lot harder the further progress that you are. And just to clear up any misconceptions, we don't, as chiropractors, we don't physically turn babies, but we create the space for the baby to turn themselves. So we optimize space in the body, and the body will do the rest. So You've always got to consider that there's other ways or reasons that a baby may be breached, and you would know that. Maybe that's called entanglement or something like that. But at the end of the day, babies will always be born how they're meant to be born. We've just got to create that space and reduce any interference in the body. That's essentially what we do. But to answer your question, the number one thing that women can do is to stand. So I'm currently standing at the moment. I try my best to practice what I preach, and as a result, I've gotten massive swollen feet as a result.
Now,
People keep telling me,
how many weeks pregnant are you?
I'll be 37 weeks tomorrow.
We didn't even share that, sorry.
Oh, yeah, so there's a bit of a bump happening here. Yeah, and I've had a completely smooth sailing pregnancy, absolutely no pain, and a lot of people were surprised when I tell them that, and I'm like, well, that's normal.
That's normal.
But,
yeah, that's what it can be. And I do have to just quickly say, if you want to see the most beautiful pregnancy photo shoot, jump over to your page, because that's one of my big regrets. Is not, I think, first pregnancy, you're really conscious of having all those photos, and I definitely, when I was pregnant with Theo, didn't. And I just love that shot of you and your son in the beach. It's beautiful.
Yeah, blessed with an amazing photographer, so really glad we got that done. So back to your question, there is a big trend now. Australia has the highest rates of caesarean sections we've ever had in the history of time. And I think that you'd be able to help me out here. The statistics currently about 37% of Australian caesarean.
If you take the whole private and public sector, it's currently sitting at about 42%. Because our private hospital rates bump up the public hospital, but on average, between 37 and 42% C-section.
Yeah, and a big component of that is malpositioning. And we do have to question, what are we doing now as a society, as working class, as women now that we weren't doing before? And a lot of that is we're being sat at desks. So women, well, humans were not designed to be sat. We were designed to be upright, bipedal, hunters and gatherers. We weren't designed to be sat at a computer, but that's largely what we're doing. And a lot of women, understandably, will take all of their maternity leave post-baby and work right up until the baby's due to maximise time, and I can understand that. Whereas I try to encourage women, if you can, try and have a bit more time than 2 or 3 weeks before the baby's due, because it's really not ideal for women to be just sat at a computer or at a desk job for such a long period of time when they're at that stage of gestation. However, if you are stuck at working to a late period of time, you will just want to work smart. So kneeling chairs are really good, sitting smart, making sure your hips are higher than your pelvis, using a standing desk, all really helpful as well. But obviously you want to factor in the rest and not getting swollen feet, because that's not pleasant either. So you just want to try and balance it. You don't want to be doing one thing too much.
And I guess really listening to your body. I know that I was still doing shift work and night shift as a midwife when I was pregnant with Polly, obviously on my feet a lot, which was a good thing. But with Theo, I had more of a desk job. I was a management role in health. And I the discomfort of that pregnancy was so different to when I'm up and shift working and able, like if you're on an evening shift, you're able to go for a swim or a walk in the morning. So it is really interesting how that can play out with how your pain is in pregnancy. Now, for anyone who is watching, please, and I should have said this as well at the beginning, if you would like to ask any questions, please feel free to post those. Someone has just put a question that I grabbed earlier when you were speaking, twin pregnancy question mark. And I guess just wanting you to speak to the benefits or what you can be doing around twin pregnancy.
Sure. So it's no different. Twin pregnancies still need space. In fact, you need a lot more space because you've got multiple babies in there. So you really want to have a beautifully balanced pelvis in that way, particularly if your aim is a vaginal birth. But a lot of women get confused with, well, if I'm not having a vaginal birth, I don't really need to worry about my pelvis so much. And there's some merit in that. If that's not a concern, that's okay. But it's not just about the birth. The birth process itself is only a small part of the big picture of things. So it's about maximizing comfort for the mother and also creating as much space for the baby, for the baby's development as well. Now, 90% of our brain stimulation, I'm going to ask you, Edwina, do you know where it comes from?
No.
Yeah, most people don't. But 90% of our brain stimulation actually comes from movement of our spine. Isn't that cool? Yeah. Yeah, so that's why when
for
we...
us as well, now.
Yeah, every human being, no matter what age. So that's why when you sit for long periods of time, like at a desk job, it's really tiring. Or if you go for a long haul flight, back in the day when we could, is really tiring, right? Like it's exhausting because your brain just doesn't get that neurological input. Now, on the flip side, we know that when we adjust the spine through chiropractic adjustments, we can actually derive stimulation to the brain because of all the receptors around each facet joint of the spine. And there's the studies that back that up too. There was a study done that showed that after an adjustment, you can actually get 10% change in prefrontal cortex function, which is huge. Like that's just my... Yeah.
So I actually work with a high performance coach, and consciously every hour I stand up, walk, either do push-ups or squats or just something to get me moving.
Yeah.
And I'm like, that's the science behind it.
Yeah. So that's a hot tip, ladies. If you're getting really tired, just do some gentle stretches, get moving, move your spine, get adjusted. But where I was going with that, the same applies in utero. So in utero, the baby is forming neuronal connections at a remarkably rapid rate. So the dendrites form synaptic connections, and then they form the long spinal cords. And the spinal cord is the same tissue as the brain tissue. It's just extremely dense, and that's what our grey matter is. Now, all those connections are based on stimulation. So those movements that we're feeling in utero, guess what's happening there? Brain development.
Yeah. So space for them to move. When you've got swing board, you need a lot of space. That's
I know. It's so cool, right? So you can actually influence the integrity of your child's nervous system before they're even born. So I always smile whenever I feel my baby kicking. If they're kicking me up at 3 a.m. in the morning, I don't mind. I'm like, oh, they're just getting a little bit smarter.
Just getting smarter. Isn't that awesome?
So you need to allow really cool. So it's all about allowing that space for the baby to have that neurological maturation and development. So getting back to my point, it's not just about the day, whether that's cesarean or vaginal birth. The pelvis position is so important for comfort of mum, but development of the baby as well. And you would know, having been brought breech yourself, when we are born breech, it increases your risk factors of developmental hip dysplasia, plagiocephaly, clubfoot as well. And we know that plagiocephaly, which is the flattening of the head, for those that don't know, flat spot. Again, a lot of women or mums will be told that's just normal. The baby will grow out of it. It's just aesthetic. And we know that's not true. There is a lot of evidence that shows that with plagiocephaly, there's a known correlation with a loss of IQ at school age by 3 points.
Yeah, okay. Gosh, that's amazing. I am still just mind blown from the movements and
now,
like
it's all about movement, ladies. So keep moving yourselves, keep allow that.
It's frustrating, those movements, as you say, that wake you up at 2 a.m. with that uppercut. It's like,
just to make it a little bit of a, more doable, ladies. That sleep deprivation's not for nothing.
Yeah, absolutely. And I had a very, very active second baby, so I'm concerned about what that might look like.
I bet they're very clever as well.
And he is very. Kimberly, are you happy? I have a few questions that have been sent through as DMs.
Sure.
The first one being, I am 31 weeks pregnant and breech. Big question mark. Okay. What can this mama be doing?
First of all, don't stress. You've got time. So it's really easy to start panicking. And I've been in that situation where I was told that my baby was breached by my midwife, but I knew in my mind baby wasn't, but it does plant that seed of doubt. So I can understand the anxiety or the fear that you must be going like, oh, what if the baby is breached? So when I was told that, I acted as if. So I did everything I could that I knew with my skills and my training to minimize the chance of breach. And sure enough, the next time I went back to the midwife, she said, oh, actually the baby's just so far down, I completely missed it. So 31 weeks, you've still got plenty of time. Don't stress. But you need to be proactive now. So keep moving, standing, over sitting, on all fours. You want to create a really nice open pelvis space and get checked. You've got to go with your chiropractor and get your spine and pelvis checked, definitely. So you feel free to shoot me a message and I'll try and find you a pregnancy chiropractor in your area, definitely. But there's lots of resources like the Spinning Babies website, optimal maternal positioning. There's lots of stretches you can do for the psoas muscles, forward leaning inversions, all those things you can be utilising. So there's a lot you can be doing yourself if you can't, and on top of getting to a chiropractor as well, for sure.
And personally, I also swam quite a lot, and I felt like that was how I felt comfortable exercising. I don't know if that was, but it was just a position that I felt comfortable exercising in, and I felt like it made up for a lot of my desk time.
100%. And the reason why that is, so I wish I had a pelvis with me, but pretend this is the pelvis.
I have my pelvis in the office as well.
Oh, cool. So this is the sacrum back here, and this is the symphysis pubis. So when we sit, the pelvis tilts back, so it closes that space. But when we're forward, it opens, and that allows more space for the baby to then descend into. And babies are really smart. So if there's not space down there, they're not going to hang out down there. They're going to hang out wherever there is more space, and that's often up there. So with your swimming would have put your whole pelvis forward and create a nice hammock for your baby, and that's what would have really helped. So I've been spending heaps of time in the pool. So again, if you are breech ladies, just get to the ocean, get your belly in some water, dig yourself a belly pit. We want to be spending lots of time forward to create that hammock space for the baby.
Yeah, absolutely. I love that one. This is one probably more around the baby side of things, and I think you do care for, earlier said, around paediatrics. So
definitely.
Barb had a forceps delivery and now bites when feeding. Is there a connection? Now, I don't know how old that baby is, but I just
look,
educated
in terms of the research, I can't say that there is, but in my clinical experience, I have found a link with a forceps delivery that does pertain to a traumatic labour. So obviously there was some resistance where the baby was unable to move through the birth passageway and that needed the additional assistance. Now, research shows us with MRI studies that 85% of newborns are born with a subdural hematoma. So that's a bleed on the brain. So for anyone that says that birth is not traumatic, I beg to differ. Now, often that will resolve and the hematoma is only less than about 5 mil. But that just shows you that in a normal unassisted birth, it can be traumatic. So when we increase that with malposition or forceps or prolonged labour or precipitous labour, or later gestation, so 40 plus weeks or big birth weight, that actually increases the risk of birth trauma. So it does sound like the baby would have had a bit of a rough entrance into life. And when the baby is born, there's a lot of pressure put on the neck and the cervical area there, which innervates all those the cranial and oral areas as well. And that's what the baby uses for that suck and the latch. So very, very commonly we'll see babies that have had, those birth factors result with feeding issues. So I would,
does that look like for that mother and baby, let's just say, for example, presenting to you at your practice, what would you, what does that look like? Just, I'm kind of just curious from a mother point of view, what does that look like for your newborn? I understand it's very gentle, but I think it's nice to be able to share that.
Absolutely. There's a lot of information about chiropractic and babies, a lot of, fear-mongering and rubbish stories we see on the internet. But
let's address that.
Yeah, that's great. In my office, we always do a complimentary check of baby for our pregnant mums, because we know that the birth process can be, it's not just hard work for the baby, right? All those contractions that you're feeling, the baby's feeling. And
so running a marathon.
Oh, absolutely. So we do a history on the feeding, like, is baby preferring one side over the other? Are you getting any cracked nipples? Like you said before, breastfeeding shouldn't actually be painful. And if the mum is experiencing cracked nipples, that's a big sign that there's some kind of dysfunction there. So we would look at that. We would look for tongue tie, all those sorts of things as well, which obviously needs to be referred out. But getting back to the feeding issue, it's a lot of cranial work can help clear up feeding problems there as well. So it's all about the nervous system. You've got to remember that the body is extremely smart. We all have innate intelligence within us, and we all have the power to self-heal and adapt unless there's no interference. So chiropractic removes interference via the spine and the pelvis and the cranium. So with newborns, the pressure that we would use is the same pressure you would use to stick in your eye. So it's actually quite light. But again, how do babies let us know when they're uncomfortable? They'll cry. So oftentimes if there's a bit of tension there and we're contacting through there, they'll let us know about it. That can be quite confronting sometimes for new parents. But yeah, a lot of the time they just sleep through it.
That's the only way that they have to communicate at that age. So.
Yeah, exactly. And that's another thing. A lot of mums get told, oh, yeah, your baby's crying all the time. That's normal. Again, it's not.
Not all the time. Exactly. No. This mama has said, any tips to relieve a sore neck, looking down a lot while breastfeeding? Oh gosh, I remember that.
Yes, all that to look forward to again. I would definitely recommend a breastfeeding pillow. That was a game changer for me when baby was, you know, when they're newborn, they're so light you can hold them, but when they get so heavy, you end up doing this.
Yeah. And also you just can't stop looking, but then you're going, stop looking for a minute.
Yeah, you can't not look though. But your head weighs about 6 kilos on average, and if you put side, your ears need to be lined up here. But when you're breastfeeding, this is what you look like, right? So for every centimetre forward your ears are of here, you actually add an extra couple of kilos. So if you're breastfeeding like this, that's an effective load of about 35, 40 kilos. So no wonder you're getting a sore neck.
And I've got a really big head, so that would be...
Yes, me too. So breastfeeding pillows will just help keep your elbows nice and neutral so that you're not using the shoulders. So that's one thing you can do. I would take just a regular break from looking down, or, you know, nodding off if you're feeding during the night, and just to stretch your neck up like that as well, just to give a bit of extension through there. But again, pain is always there to act as a warning signal that something's not right. So go and see a chiropractor as well. Definitely.
Yeah, that's great. Now this question is a bit, my baby's back cracks a little when I pick him up. Is this an issue? I feel like I'm being too rough.
Sure. That's a really common concern that parents have. I wouldn't be too worried. The babies, when they're born, have a lot of relaxant from the mum as well. So their joints are really loose and they're really supple. And babies are actually born with more bones than we have as adults, because they need to be really soft and malleable to move through the birth canal. So a lot of that is just the joints settling into place. So I wouldn't be too concerned about that.
Not anything to worry about.
No.
Okay. And then our last question is, it says, can you strain your pelvis? And I'm sorry, often in these little question boxes, it's hard to put much more detail in there. And she just says, can you strain your pelvis, early in pregnancy?
So a strain is technically a overstretching or tearing of the muscles, the ligaments. So it's not likely to be a true strain unless you've had a significant trauma, in which case it would. But it's unlikely you've done a true strain. But what you can definitely do is misalign the pelvis. You can definitely do that, and that's really, really common. And us chiropractors, we call that a subluxation. So you can definitely have a pelvic misalignment or pelvic subluxation, and that's really, really common. And if that's happened in early pregnancy, I'll get onto that ASAP, because that's not a good way to set up the pregnancy. Because if your pelvis is misaligned, like this, for example, you're going to be bearing more weight on that one side, and that can create enormous load on the surrounding pelvis muscles, uterine ligaments, the pelvic floor. And as the body, you put on weight and your body changes with the pregnancy as well, it can lead to further strain. So if you're getting problems at the beginning of pregnancy, please do not put them off or think that you're going to deal with them later. The sooner you deal with them, the better outcome you're going to have.
And I think one of the key messages that you have shared with us tonight is that pain is not normal. Like, pain is not, you don't have to be putting up with pain. Please go and see someone, talk about that, not just think, oh, well, this is part of being pregnant. And I really, like, that's amazing. I know, just go, I meet so many women that's like, oh, well, this is part of pregnancy. I'm like, no, it really doesn't have to be.
Well, here's another fun fact for you. You've got millions and millions of nerves that make up the network of your nervous system. What percentage of your nerves do you think can sense pain?
Sense pain?
Mm.
I don't know.
Do you want to have a guess?
I'm feeling like this is like my favourite trivia night. I don't care if anyone else is.
I'm asking questions.
Enjoying myself.
Okay.
I'm feeling like it's going to be surprisingly low, but I would have expected it to be high.
Yeah, and that's what most people think, like, oh, surely everything can sense pain.
Yeah.
But oftentimes it's not until problems or pathology has progressed too far that your body will register pain. Like your heart, for example. If you're sensing pain in your heart, you're in serious trouble.
Yeah.
If I was to say, how's your sleep going today?
Yeah, to be able to
exactly.
Go, wait a minute.
Yeah, so the answer is only less than 10%. So 8.9% of your body's nerves can even sense pain. So if your body is at that point already, it's sending off the flares, you need to address it. So you don't want to wait till your body's in pain. And that's another comment I receive as well. A lot of people say, well, I don't have any pain, so why do I need to see a chiropractor? Well, you don't want to wait till you get into pain, because then the problem's been there for a very long time. So you can have other warning signals before you like signs and symptoms before you get the actual pain, like maybe your digestion isn't functioning so well, or energy hasn't been so well, or some pins and needles or something like that. So your body is extremely smart. It'll always let you know when there's dysfunction, but pain is a red flag, warning light that something's right.
And your body's going to go into stress. And I think that's a lot of what I teach in the childbirth education courses, is that it's not just sitting and waiting until you're in pain, sharing those tricks about how to be more comfortable throughout the whole labour and birth, as opposed to, I want an epidural now. Like, it's that, no, what can we be doing? How can we keep movement, heat, water, massage, reflexology, all of those things are going to make a huge amount of difference, as opposed to when your body's just in stress and can't hear all those other messages. So
and on that note too, Edwina, it's about balancing the nervous system between sympathetic and parasympathetic. And as you would know, hypnobirthing and the relaxation and all of those things are geared towards setting the woman up to be in that the parasympathetic mode, which is rest, digest, reproduce. There's no way we want women in that high stress sympathetic dominant state when they're pregnant. And this is what we could actually measure that in our practice. We have some really cool technology that can measure the state of someone's autonomic nervous system. But the state that your body is in is dependent on the amount of control in the nervous system and the amount of stress that it's under. And that's chemical, physical, mental stresses as well. So it's all about keeping your body resilient and adaptable. And if your body is in that sympathetic state, you have increased pain sensation, increased cortisol levels, and all the rest. Yeah.
Everything we don't want. And as you say, knowledge is power.
Yeah, 100%.
Thank you. That has been so insightful and amazing. We will save this onto our IGTV, and I will be sure to tag and share this with you and with Oasis. Oasis, isn't it? Yeah, I'm right in saying that. Yes. And we can't wait to hear when Bubba arrives.
Oh, thank you. I'll keep you posted. I have a feeling we're around about 2 weeks to go. So hopefully, because I've got a few massages I want to fit in between now and then.
Yes, absolutely. Enjoy this time. I hope it's not, is it stinking hot over in Perth, or have you had a mild summer like us?
No, we've had a few 40-degree days, which has been awful. But we're just locking ourselves indoors.
Yeah, good. Turn the air conditioning on and enjoy. Well, that has been amazing. Thank you so much for sharing with all the birth beat mums. Absolutely.
Pleasure. And if anyone has any questions, feel free to DM me directly. And also, if you want to find a chiropractor in your area, not all chiropractors will see pregnant women. That is a bit of additional training as well. So if people need help locating one, just shoot me a message and I can put my feelers out and try and get you someone great to look after you.
Thank you. That is so generous. So anyone who has anything that they want to ask, feel free to DM you. But also if they want to find a chiropractor in their state or town, you'd be able to help with that.
Beautiful. Thanks, Edwina.
Thanks, team.
Thanks for having me. See you, everyone.
Bye.
Bye.